Okay, good afternoon to everybody, and welcome to this global assembly. My name is Vishwas Satgar. I'm wearing two hats in this convening engagement. I'm an academic at Wits University, and I teach on the Global Labor University program. And through the Global Labor University program, which has thrown its weight behind this, we've been able to network in our comrades and allies in the trade union movement in South Africa, on the continent and beyond. I also wear the hat of the Cooperative and Policy Alternative Center, a grassroots NGO in the South African context for the past 21 years. And we've co-founded the South African Food Sovereignty Campaign, the Climate Justice Charter Movement. And again, in that context, we've been able to reach out to allies, both in the country and beyond, to be part of this platform this afternoon. I'm going to co-chair this assembly with Zanele Matebula, an official from COSATU, as well as Comrade Ruth Intlekotse, who's the Deputy President of the National Union of Metal Workers of South Africa. I'll just make one or two more context-setting comments. We have rallied this assembly under the sort of broad slogans, Stand with Africa, Safe and Effective Vaccines for All, Healthcare and Frontline Workers of the World Unite. Now, the context in which we are convening is very, very important. It's 1 year of the pandemic in most parts of the world. We've had over 11.9 million cases of infection on the planet. We've had 2.6 million deaths. In the context of Africa, it's having its second wave. And as it stands of March 8th, we've had 4 million cases on the continent and almost 106,000 deaths. And the situation in Africa is poised to get worse. We have a few hotspots like South Africa, Egypt, and Morocco. But again, the world cannot move forward without ensuring safe and effective vaccines for all, including Africa. We now have vaccines in play in the context of this pandemic, but again, the rich countries have hoarded and bought out all of the vaccines. And so we have a supply crisis on the planet right now. We also have the COVAX facility and bilateral attempts by African governments to secure vaccines for their populations. But again, many have reached the conclusion that Africa will not have its vaccines this year. Actually, a minority of the population on the continent will have vaccines. The WTO refuses to provide a waiver to its TRIPS agreement to ensure that surplus production capacity in the global south can be utilized to produce more vaccines. So in that context, we have three basic objectives for this convening. The first is to push back against big pharma, the rich governments in the global north, as well as anti-vaxxers. I mean, at the highest echelons of the Tanzanian government, there's an anti-vaxxer position also on the continent, but also against lumpen elites who will want to indebt African governments and countries in the context of trying to procure vaccines, but also have corruption running rampant in the midst of all of that. The second objective for us is to build convergences. There's amazing work that's being done through People's Vaccine Campaign and various other initiatives, but we felt that it was important to strengthen that, to bring together global labor forces as well as global civil society, and to strengthen this common effort for a people's vaccine for everyone on planet Earth. And the third objective is to be catalytic in this conversation. There is an important need for us to cement our solidarities in national spaces, in continental spaces, and globally. There are several meetings of the WTO this year that we can still rally around. There's the UN convening in September, and there might be other initiatives in national spaces that you want to bring to the fore on this platform. So today we are hoping that we can get some kind of springboard action going to strengthen a global engagement around the need for safe and effective people's vaccines for all. So with that, I'm going to hand over to Comrade Zanele, and she's going to convene like the first panel, and she'll introduce it and the speakers. Thank you.
Thank you very much, Comrade Vishwas, and good afternoon to everyone. I know others, it might be evening and others might still be morning. So welcome everyone. The panel is panel 1 and it is led by the trade unionists operating in South Africa, the continent and the global arena. They will speak to the vaccine challenges, the struggles of healthcare and frontline workers, the importance of public health and internationalism. We have 9 panelists with us today. Comrade Baba Aye, who is a Health and Social Services Officer for Public Service International, PSI. And we have Zwelinzima Vavi, the General Secretary of SAFTU. We've got Silvia Habekost from Berlin. She's a nurse and a union activist for ver.di. We've got Keith Jacobs, who's the Regional Secretary of UNIC Global in Africa. We have Comrade Mike Shingange, the first Deputy President of COSATU. And we have Safiyanu, Dauda, Mohammed, who is the Regional Secretary of ITF Africa. We have Wiseman, Dinwa, Head of Education of Nactu. We have Elijah Chiwota, Communications and Research Officer of IndustriALL Global Union. And last but not least, Comrade Godfrey Masale, my apologies. Selematsela, President of Fedusa. Sorry, Comrade Godfrey. So those are the 9 panelists that we have. And to start us off will be Comrade Baba Aye. But before you start, please note that we have given 3 minutes to each speaker. And each will have, I will send you a message on the chat box. Please check your chat box. Once 2 minutes is over, I will send a message just to alert you that your time is about up. And once I send that message, please wrap up or check the screen. I will also alert you via the screen that your time is up. So I will hand over to the first speaker, Comrade Baba.
Thank you, Zanele. It was clear for several years that a catastrophic pandemic was in the offing. Years of public cuts in funding of health and staff wage freezes had left public systems ill prepared. Despite the warnings, despite the increasing transmission of zoonotic diseases that had made it clear the world would not be as lucky as with SARS at the beginning of the century, governments did not take action. But while there had been cuts in public health funding, global private sector interest had expanded. Health had become probably the fastest growing sector of the economy, drawing in some 8.9 trillion US dollars by 2019, up from 5.44 trillion just 5 years earlier. It had been growing at 7.3%. Health was seen as big business and not the public good that it should be. And that is the reason why you didn't have personal protective equipment for staff. There were shortages of beds, particularly in developing countries, but across the world. There was initial razzmatazz when the pandemic started that made there be hope that the governments and the corporations would listen to the voice of reason. But it became clear early on that this would not be the case. Intellectual property rights that are now coming to the fore with questions around the vaccine first played themselves up when health workers in Italy during the surge, produced personal protective equipment with 3D, and they were threatened with being taken to courts for breach of property rights. So now with the vaccine, you see public investment contributing significantly to the rapid development of these. Not less than 111 billion US dollars were contributed by governments, as well as know-how. But for the corporations, it's all about the profit that will be made. Pfizer and BioNTech alone stand to make over $13 billion from their vaccine. Now, the thing is that we have a vaccine imperialism, not because of lack of know-how, but because profit is considered first. And this is exactly what working class people have to resist. Working class internationalism is central to challenging this. But in our struggle for a people's vaccine, that is a vaccine that is available to everybody everywhere at no cost, we should see it as part of a broader fight for universal public health, because the reasons, it shouldn't be an episodic battle. The WHO Director General pointed out at the beginning of this pandemic that we are likely to still be even less prepared for the coming pandemic. And this means that the norms we set now will be pivotal to determine how governments respond, not only to this particular pandemic, but to the issue of our health and pandemics later. Crisis preparedness is not something distinct and separate from public health systems. They can only arise where you have well-funded, adequately staffed and strengthened public health systems. For us in Africa, there are, I mean, globally, governments make verbal commitments, sustainable development goals and all that, but their work is often different from their talk. 20 years ago in Africa, government committed in the Abuja Declaration to spending 15% of budgetary provision for health. Less than 10% of countries have at any time, implemented this. These are some of the issues we should fight for at this point in time in showing the interconnectedness, of the struggle for a people's vaccine, the struggle for public, and the needs for a new global order. Often the neoliberal project is, put as something different from the post-World War II order, which saw the welfare state with the NHS in Britain and the developmental state in Africa. But this did not in the global south. But this did not just happen. These were compromises by the bosses as a result of stiff fighting for system change by workers across the world. We have to take the battle back to them. It is not a defensive struggle. We must turn this into a counter-offensive to win a better world. Thank you.
Thank you very much, Comrade Baba. I will now hand over to the GS of SAFTU, Comrade Zwelinzima Vavi.
Well, Zanele, I thought that we were going to follow the alphabetical order in terms of the names. In that case, I would have been the last person to speak. Good afternoon again, comrades, and thank you very much. Many, many years ago, we were warned by a gentleman called Karl Marx that the capitalist system is going to eat the two pillars that it stands on, the working class and the environment. We are in the middle of that metabolic shift that Karl Marx spoke about. We are reaching the end of the earth as we have known it, because the capitalist system as a system is eating the mother earth, and we're now sitting as witnesses to the marauding diseases, vaccines, you name them all, from the African continent to the rest of the world, and from the rest of the world to the African continent. Vishwas have already spoken about a staggering 116 million people that have already been infected by the coronavirus. He spoke about a 2.6 million people that have already died. And he spoke about this week, the World Trade Organization's refusing to waive so that the trips, so that the countries in the South, the countries in the developing world can have access and can produce their own vaccines in order to fight a pandemic that, if left alone, will wipe the entire humanity. We are in the middle of that crisis that so many of us have spoken about, an environmental catastrophe and the catastrophe of all of these diseases that are visiting us. So we are sitting here as the working class today debating how we're going to be responding to this unfolding calamity. The first point that we must say is that, of course, the battles of the world start at the local level. There can never be a defeat of the system in a struggle that is based on just networking through Zoom facility, the trade unions and progressive forces of the world, and think that through that you can win, or even to begin to tilt the balance of forces in favor of the working class anywhere in the world. We are trade unions from South Africa. We have been facing our own pandemics in our country. We inherited these pandemics from the colonial capitalist and the apartheid era. These pandemics have worsened in the first 27 years of our democratic, or so-called democratic, breakthrough of 1994. We're sitting with the worst unemployment rate in the entire world. We've become the most unequal society in the entire world. We're sitting with levels of poverty unseen in the history of this country, with 70% of the population today living on a mere upper poverty levels of 1,260 rands. We are facing a pandemic. In the midst of that pandemic, we have a government that was elected mainly by the poor and the working class, who honestly believe that this regime will have their best interest in heart. But unfortunately, when the many other crises of capitalism hit our shore, as the 2008-2009 world economic crisis, this government of the ANC chose to respond by cutting expenditure and embark on a massive austerity program. It is that austerity program that workers are revolting against in South Africa. SAFTU was in the streets on the 24th of February, the day that the Minister of Finance, with the members of Parliament,
Yes. Sorry.
My time is up.
Yes, please wrap up.
Oh, Zanele.
You have only 3 minutes.
Okay.
You've already gone up to almost 4, 5.
That program is cutting even the healthcare budget, is cutting even the education budget, even the CCMA, even the police. Everybody is not left alone. And the result of that is that the nurses, the doctors do not have adequate PPEs, and they are dying in South Africa, left, right, and center. And that's what calls for unity, not through some rhetoric. Unity in action amongst workers here in South Africa and between workers of the world. Thank you very much.
Thank you so much, Jess Vavi. And I will move on to Comrade Silvia Habekost from Berlin. The floor is yours.
Yes, hello. You did say my name right. I'm Silvia Habekost, and I work as a nurse in Berlin, in a Berlin city hospital. And I've been doing so for more than 30 years. I'm also a union activist in my union, ver.di, the German Service Civil Union. The image that many people have of Germany from the outside is one that we have a great health system for all and an effective way to deal with a global health crisis like the COVID pandemic. But at a closer look, this is not the case. The pandemic put the focus on problems we've had before. There might be enough hospital beds, but not the necessary staff to care for the patients in all the beds. Long-term care is dramatically understaffed and underpaid. Personal protective gear was not available in sufficient quantities because of just-in-time storage and production, and global delivery chains broke down. Workers who keep the system going, nurses, physios, cleaners, assistants, are on the lowest pay scale and often female. The gap between the rich and poor increased. Working and housing conditions in industries like the meat industry, in agriculture or delivery centers led to outbreaks and high infection rates. Our fight against the focus on profit and not the patients in the health system started long before the pandemic. Nursing staff levels are some of the lowest in Europe. The working conditions have led to an exodus of nurses and to a dramatic shortage. In the first wave of the pandemic a year ago, the shutdown was radical enough to keep the infection rate comparatively low. In the summer, the capacities of intensive care units were increased, but the numbers of nurses were not. Also, schools did not prepare for the restart of school year after the summer break. In autumn, the second wave hit, and Christmas shopping was more important than the prevention of the virus. The second wave led to dramatic situations in the hospitals and a much higher number of deaths, which could have been prevented. Over the past year, my colleagues and I were constantly organizing for a change in healthcare financing, for better pay, and for mandatory staffing levels. In Berlin, my colleagues and I are at the start of a campaign to reach a union contract for staffing levels and union wages for all hospital workers. I want to make clear that Germany is not the global health champion. Nationalism comes first. The best example are the vaccines. There is no national solution, not in this globalized world. SARS-CoV-2 is the virus. Neoliberal globalization is the pandemic. The world needs decolonizing. As a start, vaccines have to be made global public goods. It's not a question of charity, it's a matter of global justice. What we demand is global health justice and the socialization and collectivization of the healthcare sector and the pharmaceutical industry. The privatization of profits and socializing of the losses have to stop. Health and access to healthcare is a human right and not a commodity. What we need is a real change in politics. We need local and global revolutions. My colleagues and I, we fight locally, but think globally. We have a slogan in our fight. Mehr von uns ist besser für alle. More of us is better for all. And that slogan also works for this assembly. Thank you.
Thank you. Thank you very much. Our next speaker, I'm going to hand over to Comrade Keith Jacobs of UNI.
You need to unmute.
Thanks, Comrade Zanele, and good day, comrades. The World Health Organization's Africa Immunization Coordinator said in January that the objective is to vaccinate 20% of the African population by the end of 2021. Now, this is in stark contrast in what is currently happening in the developed world, where rich countries are bulk buying vaccines, like Comrade Vish said, to ensure that they reach herd immunity sooner to get their economies going. Now, we, comrades in UNI Global Union, believes that vaccine access should be universal and free of charge, and we actively support the global efforts for equitable and widespread vaccine distribution. The essential right to a safe workplace must include the right to vaccination, regardless of whether you live in New York, London, or in Blantyre. To this end, UNI Global Union will continue to campaign that the World Trade Organization give a TRIPS waiver for developed countries to also produce the life-saving vaccines. Now, during the scramble for Africa between the late 18th and 19th century, those who came to colonize and plunder the resources of the continent brought with them new technology that they kept for themselves to conquer and steal. This cannot continue in the 21st century, where these very same countries who build their economies and technological power with the proceeds of their plunder will keep life-saving vaccines to themselves and for their own economic recovery. We are saying that big pharmaceutical companies and multinational corporations cannot be the ones that are now making massive profits and are through the back door putting pressure on the WTO themselves to not provide the TRIPS waiver so that they can continue to stock their coffers at the expense of those in the developing world, and in particular those here in Africa. We are calling upon those in power to now ensure that all have equitable access to vaccines. And for those countries, especially here in South Africa, we have and many other countries in the African continent do have the capacity to also manufacture vaccines that can save the lives of their citizens and allow them also to build back their economies that was also ravaged by the lockdowns as a result of this virus. Thank you very much for listening and for the opportunity.
Wow, you did below 3 minutes. Well done. I will now hand over to the first Deputy President of COSATU, Comrade Mike Shingange. The floor is yours.
Thank you very much, Comrade Zanele. I want to build the record of below the 2 minutes. I have greeted everyone. From COSATU, first, I want to recognize the World Health Organization for declaring 2021 as the year to invest, or as the year of healthcare workers, and also to make sure that we protect the working environment in the public health or in the workplaces of the workers. We think that more than ever before, the world has come to recognize and appreciate the significance and the importance of and the role of these healthcare workers, because more and more of them, they continue to put their life at risk in order to serve the rest of the population of the world. And we think that, as you know, in South Africa, that about 40,000 of them now, they've already been contracted this virus, and about 2% of that 40,000 have actually already lost their lives. It's a good recognition because it is only through this public health system, and in fact, the feel protected and safe and incentivized public health care workers, that the world can be saved from this pandemic. If there's one thing that the pandemic has actually exposed, is the need to strengthen the public healthcare system rather than to rely on, for instance, in South African context, a two-tier healthcare system that sometimes the healthcare provision is supposed to be given according to the economic status of South Africans or anywhere else in the world. If it was not for the about 28,000 community healthcare workers who go around the country and do door-to-door in communities and screen people and test, and including the medical practitioners that we have in our hospitals and the nurses in the world, we think that more South Africans will have perished from this pandemic. We think by declaring this 2021 as the year of public health care workers, it is actually an investment in the people who invest their life in our own lives as South Africans. We think, therefore, we need to unite globally as a trade union movement to fight the profit-driven and profit-oriented companies that want to maximize profit at a time when more and more vulnerable people need to be assisted and need to make sure that they stay alive. That's what we need to unite and push back, so that the sick people should not be looked at as the market from which profit must be made. One of the other things that we want to highlight, we think that we must also unite and push back the brutality of those who are powerful against the nations that are weak. We call today the international world to unite and condemn the apartheid Israel for stopping and blocking more than 1,000 vials of vaccines that were meant to go to the frontline workers in the Gaza Strip that is blocked by the apartheid Israel. That is an act of genocide, that's an act of massacre, killing frontline workers that are trying to save the people in the blocked area, and then you stop them because you think that they're going to be used to kill the Israelis. We think we need to unite. The last thing we want to raise, Chair, is that there's a lot of vaccine negativism. People are very negative. There are those who are campaigning that workers and population must not be vaccinated. Our view is that scientifically, historically, vaccine has all been the only scientifically proven method that has made people to be immune from any viruses in the past. We therefore call on workers, particularly frontline workers, to be brave, to stand on front, to volunteer, to be vaccinated, so that their life first must be safe, so that they can save the lives of the rest of us. By investing in the people who invest in us, one of the things that is needed is to incentivize those, is to employ more public health workers, so that indeed, thank you very much.
Thank you, President. You went over 3 minutes. Can I hand over now to Safiyanu Dauda Mohammed of ITF Africa? The floor is yours, sir.
Okay, thank you very much, Zanele, and thank you, comrades. I'm actually representing ITF, which is International Transport Workers Federation, that is responsible for Solidarity Action Campaign and, of course, of transport workers' rights, justice, and equalities. I have my talking points will actually be focused on why equitable access to vaccine in the global south is not only the right thing to do, but the interest of all countries. We also have the need to take steps to expand vaccine production and equitable distribution. There is also a very serious need to consider related issues such as management of data so as to maintain public trust. We are seeing now vaccine nationalism. The US, UK, and EU have pre-purchased enough vaccines to their populations more than twice over. At the same time, the UN has warned that 130 countries have not received a single dose. This is not only wrong, but self-defeating. We live in an interconnected and interdependent world, and the failure to fulfill those in the global south will bounce on us all. Transport provides an example of this. Global transport chain, supply chain depends on transport workers from all over the world. A single vessel transporting goods can have, for example, Russians, South Africans, Nigerians, Germans, Kenyans, workers on it together. Without equitable access, we cannot make the global supply chains we all depend on for our food and of course for our survival. Failure to vaccine parts of the world creates risks of variants, which again can be transmitted back to wealthier countries. And this can all impact on both health and of course the global economy. More broadly, we need to be ramping up production of approved vaccines. As you all know, the COVAX facility has set a target of vaccinating 20% of the world, of the people in the world, of the people of the people in the process, the world in the process, the poorest world countries. Let me put it that way. By the end of this year, on current trends, however, even this low target will not be realized. We need to look at expanding production so that there are more vaccines available, including by tackling intellectual property, which blocks some manufacturers in the volume for producing the volume that we actually needed. Crucially, we need an approach which vaccinate workers who are at the higher risk or whose work creates higher risk of transmission to others, such as transport workers, education workers, and healthcare workers. It is important to look at other aspects of vaccination processes which if managed badly, could undermine public trust. For example, this is the management of personal data around vaccine passport. There are questions over who owns and controls this data and what accountability there is, which need to be recognized and addressed accordingly. Thank you for listening and thank you for this opportunity. Zanele, you are muted. Can you unmute?
Oh,
Okay.
sorry. All right. So I just wanted to say, just to the participants, feel free to fill in your questions on the chat line. As we continue, you will get a chance towards the end to participate through your questions. And I'm going to hand over now to Wiseman Dinwa, representing Nactu. The floor is yours.
Thank you, Comrade Zanele, and a very good afternoon to all the comrades there. First, we want to honor with respect all the frontline workers, in particular healthcare workers, for standing up and engaged in a brave fight against this invisible, brutal, and unknown pandemic. We salute these heroes and heroines who sometimes had to surrender their lives in trying to save the world population from this pandemic. Now that the vaccine is available, as Nactu, we wish to express our grave concern and disappointment on the vaccine rollout in its current form, which can be simulated to the apartheid-like style of treating the population. As Nactu, we are calling on all nations of the world to ensure equitable and fair distribution of vaccine, and also to condemn and fight the monopoly of big pharmaceutical companies in the production and supply of vaccines, and to fight vaccine imperialism by rich governments who always exacerbate their capitalist agenda through vaccine discrimination, while the poor and the working class are left to die from the pandemic. As Nactu, we are calling on all global unions and civil society to work together to ensure that the working class and the poor have equal access to the vaccine, just like the big capital and the monopolist as well. So we hope that will ensure safe and effective vaccine for all. I thank you, comrade.
Thank you very much, Wiseman. I'm going to hand over now to the next speaker, Comrade Elijah Chiwota, from IndustriALL. Comrade Elijah, the floor is yours.
Thank you, Comrade Zanele, and greetings to all the comrades who are attending this, this webinar. Most of the points have been raised by the previous speakers, which means there's a convergence in terms of our demands on our expectations on vaccine equity, and also vaccine supply constraints, the hoarding by the global north. Like America is about 1.4% of the world population, but so far they've accessed around 30% of the vaccines. And then at the same time, you've got the COVAX facility, which is meant to benefit developing countries, which is accessed far much less than the vaccines that they need. So, which means this is the global inequality, which manifests itself in so many areas of economic life, and trade unions and global trade unions have been campaigning for equality for a long time. So we can as well talk of the vaccine imperialism and so on. So instead of repeating what has been mentioned by the previous speakers, I just want to mention the point on health and safety. To say that the ILO must recognize COVID-19 as an occupational disease. This is the approach that Industrial Global Union has been taking, to say if we recognize COVID-19 is an occupational disease, and also for health and safety to be included as part of the fundamental rights under the ILO, we will then have a platform or a way of dealing with COVID-19. So this will help workers to explore different avenues in collective bargaining agreements in the countries and in their national labor standards and so on, so that they're able to deal with COVID-19. We've also had, I think in a lot of countries, there's the issue of essential service workers. So a lot of countries in Africa, they've defined certain categories of workers as essential service workers for the purpose of denying those workers their rights. So we can actually use the same definitions to say essential service workers should be the first on the vaccination line. These include the healthcare workers and so on. Thank you, Comrade Zanele.
Thank you, Comrade Elijah. And then I'm going to hand over to our last speaker in this panel, Comrade Godfrey Selematsela. I apologize for mispronouncing your name earlier. So I'm just going to hand over to you, President Godfrey.
Comrade Zanele, friends present in this webinar, Fedusa is very much delighted to be invited to this vital webinar and be part of the solution to existential challenges that have been imposed on us by the global COVID-19 pandemic. As the world begins to roll out emergency approved vaccines, one of the biggest challenges we face as the African continent is marshalling the enormous resources needed to procure vaccines on a massive scale for millions and millions who need it most. For us to begin approaching numbers necessary for national and continental herd immunities, vaccine saves lives. There we shall allow the anti-vaccine lobbies to prevent it. As South Africa, we are part of the COVAX efforts, but we would like to appeal to wealthy nations from the industrial world to same and to allow them to give the countries in Africa more of these vaccines in an effort to help vulnerable African nations and to save life. It is our view that globally all governments must work together to ensure that citizens of all countries are immunized before the end of 2021 to achieve herd immunity and save lives. Our understanding is that vaccines are one of the safest and most effective tools available to control and prevent COVID-19 infections. Those of us working in the health facilities are aware that immunizations were introduced some decades ago in preventing infectious diseases and saving lives. Chairperson, yes, the procurement of large deliveries of safe and effective vaccines is a big problem that we are facing as Africa. But it is also one of the many serious challenges we have to address as a continent when it comes to the massive rollout of the COVID-19 vaccine. I'm talking here, Chairperson and comrades, about a worrying tendency of vaccine hesitancy, where a growing number, including many healthcare workers, who are reluctant or unwilling to get vaccinated. The reason for the hesitancy seem to be many and varied and include legitimate fears of vaccines that have been highly fast-tracked compared to the numbers of years that
would normally take a new vaccine to be approved and regulated. Yeah, but maybe it is lack of good public education, and as trade unions, we must take the effort in trying to make sure that we educate our members to the effect that they are ready and accept, to be immunized, more especially the frontline workers and all the essential services. Thank you, Chairperson.
Thank you very much, Comrade Godfrey. This is the last speaker of the first panel. And at this point, I'm going to hand over to Comrade Ruth Ndukuludze, the Deputy President of NUMSA, National Union of Metal Workers in South Africa. So can I just hand over to Comrade Ruth from NUMSA?